My name is Alex G, and I will be presenting on iron deficiency in athletes. Introduction. Iron is a crucial mineral in producing hemoglobin. Hemoglobin is responsible for helping to carry oxygen throughout the blood. Hemoglobin is found in red blood cells. An inadequate supply of iron would decrease the production of hemoglobin. A decrease in production of hemoglobin would in turn decrease how much oxygen can be carried throughout the bloodstream. The most obvious cause of iron deficiency is a lack of iron intake. This can also occur with excessive blood loss. Excessive use of anti-inflammatory drugs can also lead to an iron deficiency, such as ibuprofen. It is important to identify the cause of iron deficiency in order to know how to treat it. Ultimately, an iron deficiency can lead to iron deficiency anemia, which will have to be treated by a doctor. Hepcidin is a crucial regulator of iron absorption and degradation. This is also one of the easiest ways to determine iron deficiency in an athlete or in a patient. It is important because it greatly affects the athletic community. Researchers are constantly trying to find the best supplements and routes of administration to control iron status. Our first article is the association between iron and vitamin D status in female elite athletes. The purpose of this study was to determine whether deficiencies of vitamin D are associated with reduced iron status and whether progressive iron deficiency is accompanied by inferior vitamin D status. The researchers took blood samples from 231 female athletes during various stages of training. All of these athletes were members of their national teams in various sports. The blood was tested for vitamin D serum levels and ferritin concentration. Findings. The study determined that there is an association between vitamin D and iron deficiency. It is difficult to determine which nutrient has a stronger influence on the other. It is noted that iron and vitamin D levels should be monitored for general health. The authors also suggest that further testing includes supplementation of iron, since they did not test whether supplementation of iron played an impact. The next article. Effects of intense physical exercise on hepcidin levels and selected parameters of iron metabolism in rowing athletes. The purpose of this study is to determine if intense physical exercise could cause a decrease in iron to the point of leading to anemia. To test this, participants performed a 2,000-meter max test on a rowing ergometer. Blood samples were taken prior to exercise, 1 minute after completion of exercise, and 24 hours after completion. Findings. High-intensity exercise caused significant changes in iron metabolism parameters. These parameters returned to normal during the recovery period of 24 hours. However, there was a significant decrease in serum iron levels 24 hours after the test. The researchers concluded that this decrease was not enough to lead to anemia. The role of mineral and trace element supplementation in exercise and athletic performance, a systemic review. The purpose of this article was to systematically review the literature and synthesize the available evidence on minerals and trace elements supplementation for enhancing exercise and athletic performance. This was a very broad study. It looked at multiple minerals and trace elements and vitamins found throughout the body. To do this, the authors looked at 128 different studies that met their fine-tuned criteria to assess the effects of minerals and trace elements on performance. Only 29 of these studies actually focused on iron supplementation. Those 29 studies found that iron supplementation does have a positive effect on athletic performance. It also found that parenteral administration is the superior route of supplementation. This is because parenteral administration is intravenous, which means that they are given an IV with their iron supplement, and it goes directly into their bloodstream. But oral supplements are cheaper and more common. This caused the authors to hesitate on recommending parenteral administration because it is easier for patients to receive oral supplements. The authors also found that there are a range of factors, including baseline iron status, dose, and route of administration, that affect performance. These factors should each be looked at individually in order to best make the decision of how, when, and how much, and in what way iron is given to the athlete. Vitamin D status and its relation to exercise performance, and iron status in young ice hockey players. The purpose of this study was to determine the association between vitamin D deficiency and iron status along with athletic performance. The authors focused on isometric strength tests of the upper and lower body, along with a vertical jump and repeated sprint ability test. Blood samples were also taken prior to and after the test to evaluate iron and vitamin D levels. The findings of this article were that 11 of the athletes were tested to be iron deficient. Another 20 of the athletes were considered iron insufficient. The authors could not positively correlate vitamin D concentration with isometric strength, vertical, or repeated sprint tests. This means that they could not prove that vitamin D played an important role of their performance testing. They were able to prove that iron and vitamin D insufficiency were prevalent in ice hockey players. Effects of acute exercise bout on serum hepcidin levels. The purpose of this was to explore the potential regulative role of a single session of exercise on serum hepcidin levels as a mediator of the iron absorption degradation rate in humans. These researchers reviewed every available article they could find in regards to hepcidin and exercise, then refined that information. A total of 21 studies were included in the review. Most of these studies were mainly on male participants. The authors found that 30 to 120 minutes of exercise at moderate to high intensity facilitates the upregulation of hepcidin, which means that hepcidin is higher, and when hepcidin is higher, that means more iron is being put out as waste. Responsive hepcidin has a correlation on pre-exercise iron status. So if iron is higher prior to exercise, there's going to be a higher hepcidin regulation after exercise. The authors were able to determine that iron and cranberry flavonoid supplementation could modulate post-exercise expression of hepcidin. Iron supplementation during 3 consecutive days of endurance training augmented hepcidin levels. The purpose of this study was to investigate the impact of 3 consecutive days of endurance training on hepcidin levels when paired with iron supplementation. To perform the study, the authors took 14 participants and split them into 2 groups, an iron treatment group and a placebo group. Each morning at 8 a.m., blood samples were taken to test for iron status. This was done prior to the test, each morning of the protocol, and 24 hours after completion of the test. The supplement group received an iron supplement prior to and after exercise. All 14 participants completed 3 consecutive days of endurance training. They trained twice daily. Findings. There was not a significant performance difference between the supplement and control group. This means that each group performed about the same. The post-test blood sample revealed that the supplement group actually had a higher hepcidin level. This suggests that supplementation may increase resting hepcidin levels. So the authors found that by increasing iron intake, we may also be increasing the amount of iron that is being put out and how much hepcidin is used to break down that iron. Elevated hepcidin serum level in response to inflammatory and iron signals in exercising athletes is independent of moderate supplementation with vitamin C and E. The purpose of this study was to assess the contribution of inflammation and increased circulating iron levels. The reason vitamin C and E were used is because they have been proven to help control inflammation or reduce it. To do this, 10 participants performed endurance testing before and after receiving a vitamin C and a vitamin E supplement for 28 days. Blood tests were taken prior to the test and after. Findings. The supplementation period increased serum levels of vitamin C and E, which is obvious if you're taking those vitamins for that many days. The research found that inflammation was not affected enough to note a difference other than inflammation was actually highest after exercise. The research also found that hepcidin levels were highest 3 to 6 hours after exercise during recovery. There is not a correlation between supplementation of vitamin C and E and a reduction of hepcidin. So the theory that by decreasing inflammation or controlling inflammation would decrease the amount of hepcidin released and allow higher iron levels was proved to be false. Sweat iron concentration during 4-week exercise training. The purpose of this was to analyze iron concentration in sweat during 4 weeks of exercise. To do this, the researchers took 43 untrained individuals and had them use a cycloergometer or cross trainer to train for 3 weeks. Each individual wore a sterile sweat patch on their skin between the shoulder blades to collect samples. This was done for each exercise bout. The researchers found that iron excretion was comparable for pre- and post-tests. The last day of training actually created the highest level of iron excretion. Iron sweat loss increases in untrained individuals when they begin to train is one of the findings of this research. The authors believe this is due to improvement in thermoregulation. Iron deficiency and anemia among college athletes, a retrospective chart review. The purpose of this study was to describe the prevalence of anemia and iron deficiency among incoming female college athletes. To do this, the researchers examined medical records of all incoming female freshman athletes at a single school from the years 2002 to 2014, so over 12 years. This institution required laboratory samples to be collected as part of the pre-participation exam, and these results were ultimately used to determine whether the athlete had anemia or an iron deficiency, but helped along with this research. The researchers found that 1 in 20 incoming female athletes at this institution were diagnosed with anemia. They also found that 30.9% of the females tested were actually iron deficient already. The ultimate conclusion that these researchers came to was that blood sample testing as part of the pre-participation exam should be included. they highly recommend that blood testing be done if the school can afford it. Repressed exercise-induced hepcidin levels after Dangui Buksu Tang supplementation in male recreational runners. The purpose of the study was to investigate the protective and recovery effects of Dang Buksu Tang, or DBT. Methods. The researchers used 36 males who were assigned to receive a DBT supplement or a placebo for 11 days. The researchers had each participant perform a 13-kilometer run on the 8th day to assess performance. They took pre- and post-test blood and urine samples to assess levels. Findings. DBT supplementation repressed hepcidin levels post-test and 24 hours after completion of protocol. This leads to a significant increase in iron levels during recovery, which will better help the body to recover and make sure it gets proper oxygen. DBT did not influence inflammation, so that inflammation that you see after exercise will still be there. DBT supplementation did help to decrease running time, so this is possibly a performance boosting supplement. The authors did conclude that it is worth recommending DBT for supplementation. In conclusion, as we can see, iron deficiency is a major problem around the world, considering that 1 in 20 females are an iron deficiency anemic and 30.9% of females tested at one institution were already iron deficient. It is also a big problem because iron deficiency is more common in athletic populations. Part of the reason this is a problem is because it can lead to a decrease in performance. We were able to see that vitamin D and iron status have a direct correlation to each other, but we do not know which has a stronger impact on the other. DBT was the only supplement able to help maintain iron status outside of iron supplementation. Pre-exercise levels of iron are the best way to help maintain post-exercise iron status. This means that elevating iron levels by taking a supplement prior to exercise is going to be the best way to help maintain those after exercise. We also found that parenteral administration is the best route of administration. This means that, if possible, athletes and patients should receive IV administration of iron instead of taking an oral prescription. Ultimately, through this research, we found that there are not many supplements outside of a vitamin D supplement and an iron supplement and possibly a DBT supplement that are best going to help our athletes maintain iron status and prevent iron deficiency. The big takeaway from all of this research is that athletes should be screened regularly, whether this be through their annual pre-participation exam, as suggested by one study, or occasional blood tests taken to make sure that they are where they're supposed to be. Another big takeaway is that further research needs to be done specifically on iron deficiency in athletes. There were only a handful of research articles and article reviews available to break down in order to determine where, what, and how iron deficiency is affecting athletes.